lot of time we see before sleeping you watch movies or active on the social media, and that disturbs our sleep. So you should sleep peacefully. In eating a lot of outside food or junk food, which is becoming very easily available, especially after these apps. So we should be careful about the nutrition in our diet, which is important.
Hello, welcome to Common Mental Health Disorders. I am Vanshika. I am a counseling psychologist. We are here to understand common mental health disorders and their treatment. We are here with Dr. Gaurav Gupta. He is working in the field of mental illness. He runs Tulasi Rehabilitation, which is a mental health facility, and working in the field of psychosocial rehabilitation. He is also involved in the panel for Mental Health Act and is working very closely with the government to increase psychosocial awareness in the region. Welcome, Dr. Gaurav.
Hello, Anshika. How are you?
I'm good. How are you?
I'm doing great.
So today we're tackling understanding common mental health disorders and its impact on mental health. Can you share some personal insights and anecdotes for us today?
So mental health issues are becoming very common, and especially after COVID, we were socially, a lot of isolation was there, and the problems have increased. A lot of perfectionism, washing hands, as that was desired during that time, but that behavior is getting continued. And the issues are becoming very difficult. Even a lot of us lost their employment, job, and that all lead to a lot of mental health crisis. So currently, the number of patients coming for help has tremendously increased, and that make us feel little insecure, especially seeing young kids who are having issues because they were at home for many years, almost 2.5 years, and they lost the routine of going to school and following their regular social network, and that led to little crisis. So all those things are affecting. And if we talk about the common mental illnesses, depression, anxiety is one of the commonest problems. But with that, we see bipolar disorder, schizophrenia, and substance use disorder. These days, relationship issues are also becoming very prominent, and relationship problems, especially husband-wife couple are not getting along, or parents are not getting along with their kids, are becoming very common, which was not that common in our culture in the past. So definitely, I think it's an evolving field, and we see a lot of newer disorders.
Do you have any practical advice for us?
I would say that have a good lifestyle where sleeping, eating, and socialization are the three important things. We should sleep properly, restful sleep for the sufficient duration. A lot of time we see before sleeping you watch movies or active on the social media, and that disturbs our sleep. So you should sleep peacefully. In eating a lot of outside food or junk food, which is becoming very easily available, especially after these apps. So we should be careful about the nutrition in our diet, which is important. And doing little socialization, meeting our friends, talking to them, interacting with them, as well as routine or exercise. These are the few things which can be very helpful to keep us healthy. And if we are healthy, we are going to be mentally healthy. Definitely, there is a lot of hesitation to take help if we have emotional issues. So another thing would be that please take help in case you require.
Right. So that's very helpful. Let us bring up some of the listener questions here. Can you tell us how mental health affects our daily living?
For daily living, the mental health or the presence of mind is very significant, because Daily living involves so many things, like you have to make your food, you have to prepare, maybe you have to go for office, or you have to be involved in household work. All those things require a lot of healthy mind. If your mind is not healthy, you cannot plan your day in a right way, and that lead to crisis and difficult situation. So I would say that mentally healthy is essential part to lead a healthy life.
Hmm. Okay. What about, can people with mental health disorders live a normal life?
Yes, I think majority of the mental health disorders are um, does not affect life. Only very small percentage of the population feel or remain unwell or unfit in the society. So I would say out of maybe 90 to 95% can lead near normal life. A lot of time they have little ups and downs or little expression, but other time they can manage their life very well. And the problem is more prominent if you don't take help and your disorder has gone up and it has affected you very badly. Then situation is difficult. Otherwise, you can lead a near normal life with a mental illness. Very few percentage, like maybe 5 to 10% of the schizophrenic patient or bipolar patient or substance use disorder, OCD. These are the common patients who cannot. But with support, we work with the psychosocial rehabilitation, and I would say majority of them can lead a near normal life with ongoing intervention and supervised setup.
Okay, that's very helpful. So, people who are suffering from these afflictions, how do they usually behave?
So these kind of a problems are normally we see there is a change in their routine, sleep, appetite, exercise, socialization that get affected. Their working get affected. Their life is not as smooth as otherwise it would be. And we realize that there are some prominent symptoms, like for the schizophrenia we see a lot of them talking to themselves or suspiciousness. For bipolar disorder, a lot of mood swing symptoms are there. Substance use disorder, we see excessive use of substance and life is becoming difficult after that. Or OCD, we see repetition kind of a thing. So definitely there are some normal routine things which we see in lot of mentally unhealthy patients, and there are few specific symptoms we should be careful about. And I think if you feel one of your family member require some help, go and meet a doctor or a psychiatrist or psychologist and get yourself assessed. We can reach on a diagnosis, and most of the mental illnesses are treated.
Okay, thank you so much for sharing this information with us. Like you're saying that there are some resources we can go to. Can you share some resources that you know of that our viewers can use?
So definitely the all the government hospitals and private hospitals is a good resource where they can go for their assessment. Definitely after COVID, there are a lot of online mental health platform, and government is also running such platform. There you can get in touch with the psychiatrist or psychologist and get yourself assessed. Definitely, Tulsi is one of such facilities where you can come for help, and we are into the psychosocial rehabilitation. We have team of psychiatrists and psychologists who can be very helpful. So we are also can be one of those.
So, wrapping up, thank you, Dr. Gaurav, so much for your helpful insights for us. Like he has shared with us today, we know a lot more about mental health now. During the current times, people have been suffering a lot. So now you have a lot of resources open for you. Other than that, please make sure to maintain a good lifestyle, good diet, good sleep, and you can always reach out to the resources shared from Dr. Gaurav today. All right. Thank you, Dr. Gaurav, so much for being with us here today. If you like this video, please subscribe to our channel and add your questions to our comments box below. Thank you, and we'll see you in the next episode.